What's up, you guys, and welcome back to another video. This is another part of this video, but today we're gonna be showing you guys my first presentation that you guys haven't seen my previous videos. We wrote sentences, annotation notes, and models. We looked at models and wrote it down. Okay, so I'm about to present to you guys my first presentation, and I took pictures of all the slides that I'll be reading and presenting to you guys, and you have it on the screen as well. So so that's what we're gonna do today. And then I got videos that I put in my slides too, so I think we're gonna watch the videos as well. If I'm gonna do, we're gonna watch the videos as well, so to see how it works. Right, but let's go and get right into it. Like, comment, subscribe, and turn notifications on. And also, I apologize for not uploading a video on Friday. It was my last day of school, and I decided to celebrate. I was going crazy, watching videos and stuff. So I apologize, but I did post a workout video today, so you guys will see another video today, which is this video you will see today. And also you already seen the workout video that I posted today as well. So you guys will see one more video, which is this one today. And today's Saturday. So yeah, to make up of not uploading on Friday. So yeah, don't want to keep that streak going. The vlog is going as well. So yeah, posting in the summer. Right. So healthcare is my topic, social justice topic. Okay, so social justice topic, right? Healthcare. That's what I'm talking to. Okay, that's my social justice topic. Healthcare by Katrell. Okay, I made this presentation. Okay, you guys will have the slides on the screen, all the pictures on the screen. The overview topic you'll have on the screen as well. So let's go and explain it. All right. Explanation: healthcare is the system of services provided by trained professionals to improve or maintain an individual's health through the prevention, diagnosis, treatment of illness and injury. There are multiple services of healthcare that provides with any given treatment, such as primary care, emergency care to specialized treatments, mental health, pharmacy, and long-term care. Who is affected? Healthcare is an issue that impacts everyone, but in groups of racial ethics. However, everyone who gets affected by healthcare is 65 plus years old. Controversy in healthcare are wide-ranging, encompassing debates over access and affordability, ethical alignments posed by medical advancements, and as the extent of government involvement in public health and policies. Significant event in 2010, the most significant recent event transforming healthcare is the Affordable Care Act 2010, pushing shifts from sick care to wellness and its changes, but also facing changes like the removal of the individual mandate. A major event can also include the COVID-19 pandemic. Okay, so yeah. Yes, the U.S. should have a system that provides medical care for everyone at low cost. Two different viewpoints. Should the United States have universal health care? Yes, one viewpoint says yes, the U.S. should have a system that provides medical care for everyone at low cost. The second viewpoint, no, creating a universal health system that provides Americans of free choice and competition. Okay. Should the United States have universal health care? Yes, we should provide at low cost. Okay, let's read this. We got this. The next slide we will have key argument and key evidence. Okay, my article is What is the Key to Universal Healthcare by Canon Michael F. Okay. One key argument slash claim. President Donald Trump wants to reduce some of medical excessive prices. Supporting evidence in 2014, Medicare paid long-term care hospitals about 3 as much as skilled nurses facilities, 1,400 per day versus 450 per day, and per admission prices is different, about 30,000. Article 2. U.S. needs universal access to healthcare. American College of Physicians says by Janice Hopkins. Key argument slash claim. The American College of Physicians says that the United States needs a health care system that provides care for everyone. About 43.6 million people lacked health care insurance 2006, and about 89.5 million people younger than 65 lacked health insurance for at least a month in 2006. Okay, now you guys seen a few videos we talked about synthesis, which means you gotta combine two articles and put into one, but also use your own words. I use the sentence starts of how to write a sentences, right? You guys see my previous video where we look over notes of synthesis, right? So here it is. Across both sources, a major idea is that it explains how expensive getting healthcare it is. While source 1 shows the amount of money being paid in 2014, source 2 shows how many people are struggling in healthcare costs. I can conclude that healthcare is becoming expensive, a medical service for people to get good treatment, and doctors get paid a good amount of money each day. That's my synthesis. Okay, so now we're going to go into viewpoint 2, which is telling us no, universal health care deprives Americans free choice. Okay, so let's do it. Bulleted arguments. Supporting evidence for viewpoint 2. Article 1. Bernie Sanders' healthcare goals are deadly for patients by Pipe Sally. One key argument slash claim. A single payer system is proposed in California. The total cost of the proposed system, according to the California Legislative Analysis Office, could run between $494 billion and $552 billion a year. Article 2. Single payer is not the solution to America's health care problems. By Robert E. Moffett. One key argument slash claim. Congressional sponsors claims that the substitution of broad-based federal taxation for private health insurance costs would result in most American families paying less for the health care than they do today. Supporting evidence, according to the 2020 Heritage Foundation, it says that estimating would require a tax of 21.2% on earnings, and 73.5% of Americans would have at least less money in their pockets. Here's more information. Over 156 Americans today have employer-sponsored coverage. Roughly half of the American population in those households losing job-based coverage would experience an average income reduction of $10,554. Here's the synthesis. Okay. Across both sources, a major idea is that how supportive the sponsorship is being proposed in healthcare, while source 1 shows how beneficial the total amount of money being paid a year. Source 2 values the percentage of people earning the least amount of money in taxes. I can conclude that healthcare is starting to update and improve Medicare costs in a lowest level for Americans to earn and estimate for sponsorship. Okay. So we got these videos right here. I'm gonna show you guys these videos. Okay. I'll show you guys these videos. Alright guys, so we're gonna watch this first video, which is called The Healthcare System of the USA. Let's go watch that.
Whenever I talk about health policy, especially as we try to reform it here in the United States, I get a lot of requests to talk about how exactly healthcare works in different countries. Lots of countries. It's not that I don't think those are great questions. I do. It's that summarizing a healthcare system in just a few minutes isn't easy. But we don't shirk from difficult tasks here, and so we're going to start tackling countries, one by one, starting with the United States, here on Healthcare Triage. The United States healthcare system is similar to that of many other countries in that it's a mixture of both private and public components. Let's start with the easy stuff. Almost all care is provided for by the private sector. Although some hospitals are run by the government, most are run by private organizations. About 70% of hospitals are nonprofit, leaving the rest in for-profit hands. Most physicians, therefore, also work for private organizations and are not employed by the public sector. Other components of the healthcare system are also in the private sector, including pharmaceutical and medical device companies. Research is paid for by both public and private sources, with a little bit more coming from the private side. Added together, however, U.S. spending on medical research accounts for the vast majority of R&D spending in the world. But where countries differ the most is in how they give citizens access to their systems. In this area, the United States is somewhat of an anachronism. Until recently, about 15% of people in the United States were uninsured. This meant that if they needed care, they'd have to pay for it out of their own pocket. And unless you've been living under a rock, you should know that healthcare in the United States is really, really expensive. So that's a problem. It means that a lot of people don't get the care they need, and it means that we're failing a large number of people who live in the United States. About 60% of U.S. citizens get health insurance from their employer. These plans usually don't charge people different amounts based upon factors such as age, gender, or past medical history. They range in benefits, but for the most part, they cover preventive care, care if you get sick, and prescription drugs. Plans vary in terms of how much people have to pay out of pocket for them, but we already did a video on how private insurance works, and you really should have watched that already. About 15% of Americans are covered by Medicare, and most of them are elderly people. Medicare is a national social insurance program run and administered by the federal government. It's the closest thing we have to what most people refer to as a single-payer system, where all people are covered by one type of insurance. But Medicare is pretty complicated. First, there's Medicare Part A, which covers you if you're hospitalized. It's pretty much free to most people over the age of 65, and almost no one doesn't get it. Medicare Part B covers outpatient services and is sometimes deferred by people who are still getting insurance from their jobs. It is a pretty low deductible and then has co-insurance of 20%. It covers tons of stuff, including pretty much all tests or procedures you might get outside the hospital, as well as lots of medical equipment that you might use. There are private supplemental Medigap policies that are offered by private companies that often cover the copays or coinsurance, or add in extra benefits. Almost everyone buys one of these too, so that elderly individuals wind up paying much less for their health care than you'd expect. Medicare Part C, or Medicare Advantage, is an opportunity for private companies to offer Medicare-like benefits better than the government can. If they do, and they do it for less money, they get to keep the extra in profit. Medicare beneficiaries can opt into Medicare Advantage plans instead of traditional Medicare. They sometimes have different benefits that appeal to them, and about a quarter of them choose such a plan now. And Medicare Part D contains the prescription drug plans. They're actually designed and run by private insurance companies, but they're approved and paid for by the federal government. Individual Medicare beneficiaries pick the Part D plan they like, depending on what drugs they think they might need. That's Medicare. It cost us about $536 billion last year. The other big government program is Medicaid. Unlike Medicare, Medicaid is a state-based program. Basically, it's supposed to provide healthcare coverage for the poorest among us. There are some minimal federal guidelines that are set for Medicaid, and then each state gets to implement it as it sees fit. Some states are more generous and some less so. Generally, Medicaid is meant to cover those at the low end of the socioeconomic spectrum. The government defines poor this way. While you look at that, remember this amazing fact. A single parent with a child who makes minimum wage earns more than the poverty level. That's how low the line is. Regardless, traditional Medicaid must cover kids under 6 years of age to 133% of the poverty line, and kids 6 to 18 to 100% of the poverty line. The State Children's Health Insurance Plan, or SCHIP, ups this to about 300% of the poverty line in most states. Medicaid also covers pregnant women, up to 133% of the poverty line, and parents to 1996 welfare levels. Finally, it covers the elderly and those with disabilities who receive supplemental security income. The first important thing to note is that adults without children aren't mentioned at all, and in most states, they can't get Medicaid. Let me say that again. In most states, even the poorest adults without children, even those who make nothing at all, don't get Medicaid. And it gets worse. Those 1996 welfare levels can be super low. So low that, for instance, in Arkansas, a couple with 2 children making $3,820 a year is too rich for Medicaid. Granted, some states are more generous, but in many of them, parents have to be very, very poor in order to get Medicaid. The Medicaid expansion in the Affordable Care Act was supposed to fix this. It was supposed to give Medicaid to everyone who makes less than 138% of the poverty line, regardless of whether or not they have kids. It would have finally made Medicaid the universal program for the poor that many already believe it to be. But because of the Supreme Court decision that made the Medicaid expansion optional, lots of states are refusing it, leaving an additional 5 million people with low incomes with no insurance this year. In 2009, Medicaid covered more than 60 million Americans. About 1 in 3 children are covered by Medicaid, and 1 in 3 births is covered by Medicaid. A lot of Americans are in poverty. In 2011, Medicaid cost us about $414 billion. There's also the Veterans Health Administration, which is totally a government-run system that provides care to veterans, and TRICARE, the military health insurance program that applies to some veterans, military personnel and retirees, and dependents. TRICARE works more like private insurance. Think that sounds complicated? It is. Interestingly, while about 2/3 or so people get their insurance from private companies, only about 1/3 of spending comes from the private sector. In other words, the government has to cover about 1/3 of people in the United States, but has to pay about 2/3 of the bill. Tell me again how the government isn't getting the short end of the stick. The money involved in healthcare in the United States is simply unbelievable. You may remember this video of John's, which talks about how out of control our spending is. Go watch it again. It's based in part in a series I did on my blog, and the link for that is in the video info section below. I've also added a link to a series on quality in our system, which is, well, not what you'd hope for given all that spending. Obamacare will change some of what I said, but not by much. Basically, we hope to get some people who didn't get insurance for their jobs Medicaid or community-rated guaranteed issue insurance like employed people get. With respect to the Affordable Care Act, we're only talking about 30 million people or so. We're about 10% of our population. And for more info on that, go watch our first episode. So that's the US healthcare system, as neat and packaged as I can make it in under 10 minutes. It's private insurance for most, Medicare and Medicaid for some, and VA or TRICARE for a few. How does this compare to other countries? Keep watching future episodes to find out.
Alright. Let's go. Should we watch? No, let's watch the other video, but I'm gonna make sure. Oh, I can watch it.
Healthcare spending is rising around the world.
As far back as we've been measuring this, healthcare spending has always risen.
Overall spending on healthcare has doubled over the past 2 decades, reaching $8.5 trillion in 2019, which comes out to 9.8% of global GDP.
The U.S. spends about twice as much on healthcare than other large and wealthy countries do.
The U.S. healthcare system is not as effective when it comes to controlling costs compared to systems in other countries.
The way the system is structured now, it is cure-driven system, not a prevention-driven system.
There's not one access model here in the United States, and so for preventive services or treatment, it really depends on people's insurance status, where they're located, and the provider network near them.
It is extremely frustrating for not just patients, but physicians also.
The way we do it, by definition, makes things much more expensive for us.
So why are U.S. healthcare costs rising more than anywhere else? And can it be stopped? Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20% of total GDP.
So what that means is that for every dollar that people spend in the U.S., about 20 cents is going towards healthcare.
This rise in spending can't be attributed to inflation alone.
Healthcare almost always outpaces inflation, and so, healthcare costs grows faster than the economy. That's why it's representing a larger and larger share of the economy.
The United States spends more per person on healthcare than other high-income countries, but still has a lower life expectancy.
We have poor outcomes relative to other countries. We pay twice as much as any other country. We pay more and get less.
We see that people in the US use a similar amount of healthcare to people in other wealthy and large countries, but we pay more for each interaction. The money's in hospitals and doctors. That's what makes up the big difference between what we spend on healthcare in the US and what other countries spend.
Hospitals, physicians, and clinical care made up more than half of total healthcare spending in 2019.
When we talk about ways to reduce spending, you can either look at ways to reduce the amount of care that people are getting or to reduce the price that people are paying for their care. And in the US, it seems that there needs to be more of a focus on the prices of care, because that's where the real difference is between what we spend in the US and what other people spend in other countries.
Drivers of the rise in healthcare spending has focused mostly on the symptoms of the rising healthcare spending. So when we are talking about hospitals, prices are very high, or drug prices as very high, these are not the causes of the high spending. These are the symptoms of high spending.
One of the causes of high spending is the fragmented nature of the US system. Some Americans have incredibly comprehensive and affordable health insurance coverage, while others have little to no coverage.
For some people, they might spend a very small share of their income on healthcare, and that's usually because they're healthier. People who are sicker will spend a very large share of their income on healthcare, especially if they're in private insurance coverage with a high deductible plan.
Over 11% of the US population was uninsured in 2020, with a large disparity when it comes to race. 51% of Americans said they have delayed or skipped medical care due to cost. That number jumps to 63% among those living in a household with an income of less than $40,000 per year. Even those covered by insurance say they've experienced financial trouble. About 46% of insured adults reported difficulty affording out-of-pocket medical costs. The WHO argues in a 2021 report that universal coverage would limit catastrophic health spending. This lack of universal coverage can make costs rise while also leading to worse healthcare outcomes, specifically when it comes to preventative care.
When costs become prohibitive for patients to seek care is that, number one, preventative care and preventing diseases from getting worse is always going to cost less. And the cost meaning to the overall system is always going to cost less.
Let's say somebody has no insurance or very little insurance, and she feels a vague pain on the right side of her abdomen. It would cost her $120 to go to the doctor. She's not going to do that. She's going to work through it. And 3 months later, she's in the emergency room, burst appendix. It costs $60,000. And we'll treat her. But if she could have gone to the doctor when she felt that first pain, the doc could have treated the infection. It would have cost $100.
There is a phenomenon in healthcare called the cost shifting. Cost shifting happens when healthcare organizations shift the cost of those who cannot pay the bill to others who are covered by insurance providers by increasing the prices somehow.
We also have to take into consideration the concept that, maybe 30% of these bills will go unpaid, which can be thousands of dollars. So at some point, if you want to keep your practice afloat, those have to be recouped in a different way.
This is a factor of the US healthcare system where how much people end up paying is going to depend on your insurance.
A lack of universal coverage and a fragmented healthcare system also mean that people don't have the same insurer for their whole lives, which means that insurers have less of an incentive to provide preventive services or to ensure that you don't get sick later.
The majority of Americans don't have much of a choice when it comes to their insurance plan. More than 54% get health insurance through their employer.
Capitalist view works when the market is free. Healthcare is never a free market.
Instead, we have insurance companies bidding on patients' behalf, which limits patients' ability to bargain with their healthcare providers.
We have what the insurance companies call narrow networks, where they dictate which doctors you can go to.
Patients also can't bargain because they usually don't know how much care actually costs.
One key requirement in a free market is to be informed about the price of the product or good you are purchasing. But in healthcare, patients are in the dark about what the cost be when they seek their care.
Insurance makes prices even more opaque, not just for patients, but also for doctors.
Sometimes it is difficult to know upfront what a patient's costs are going to be for whatever services that they're getting. At the end of the day, we are actually not the ones controlling the rate for each different company. And even if we have a whole list of every single possible charge, we don't know if people have met their deductibles yet. We don't know where they are with respect to out-of-pocket maximums. We don't know, what their copay might exactly be, if it's a percentage.
A lot of care is delivered through what's called fee for service. That means for every service that your doctor delivers to you, that doctor is billing for each individual thing. And that can create an incentive called provider-induced demand, which is basically that your doctor has an incentive to do more things to you.
But it's more complicated than just greed. America's litigious culture can play a role in excessive testing.
I do think that in the United States, we do order more tests simply because, one, there's this fear of missing something. Of course, that comes from a human aspect where you don't ever want to misdiagnose a patient. But then there's also the malpractice side of things, where if you do miss something, what are the consequences?
Since there isn't true free market competition, insurance companies will try to rein in the spending by either denying claims or requiring pre-authorization.
Most physicians are doing the right thing and choosing the right treatments for their patients, but sometimes there are instances where the procedure that's being requested may not always be the most effective treatment for their particular patient. And sometimes the prior auth process also serves as kind of a gatekeeper, so to speak, of whether that physician has tried everything that could potentially help the patient.
There are proponents for completely overhauling the heavily commercialized system.
You have to make the commitment to provide health care for everybody. That's the destination. It turns out there are many different routes to that destination.
One of the more popular policy proposals is Medicare for All, which would replace for-profit insurance companies with government-funded health insurance.
I am a strong supporter of Medicare for All because it is our principal goal in this country to give everyone coverage at the lowest possible cost, and Medicare is the best way to do that.
President Joe Biden is instead focusing on expanding the Affordable Care Act to enable more people to get insurance. There's also been a bipartisan push for increased price transparency. Congress passed the No Surprises Act, which went into effect in January 2022. The goal of the legislation is to help Americans avoid surprise medical bills.
Now people who inadvertently go to an out-of-network provider, for example, by going to an in-network hospital but being seen by an out-of-network doctor, that patient is held harmless. And then it's up to the insurance company and the doctor to kind of work out how much gets paid to them.
Researchers and economists are still debating what exactly is driving these costs in the US.
It's very hard for people to know how much healthcare is going to cost them before they get it. Some of that can be addressed through price transparency efforts by basically posting prices on hospital or doctor's offices' websites.
Research has to be intensified in this area to clearly identify the root causes of the high spending and the interrelationship between the different routes.
There's a lot of moving pieces here, and there's probably not going to be one single solution to healthcare costs and access and quality of care and insurance coverage, but there's a lot of different directions that policy is starting to go in terms of actually addressing the healthcare costs in the U.S.
Alright guys, that's the end of those two videos. We got the work citations to this one. This is article 1. These two, when it says ProQuest, let me show you guys the link of ProQuest. This is ProQuest link. and this is ProQuest as well. And these two articles, this one and this one is the Google. These are the links from Google. These two sources right here are ProQuest. Okay, so this one is ProQuest. This one and this one is from Google. These websites is from Google. Okay, so that's it. Shoot. Alright, so thank you guys for watching. Okay, hopefully you guys enjoyed this presentation video. That was a little longer, but I want to give you guys presentation since this is a follow-up to all the videos that I've been showing you, that I've been writing and showing you guys. So this is the last piece and the last video of this type of topic. This is my healthcare social justice topic. Hope you guys like it. Let me know if you did a presentation and what was your social justice topic. I'm thinking about doing more of these if you guys want. So let me know if you guys want to see more different topics like this. Me going through Google and doing different topics and going to different websites from ProQuest and non-ProQuest. Let me know if you guys want to see that more of these types of videos. Alright, but this is not. I don't think I'm gonna really call this a survivalist video. I'll just call because I ain't write anything. We're just gonna call this real life vlogs. Okay, we're gonna make this a vlog video. You know what I'm saying? So thank you guys for watching. Please like, comment, subscribe, turn notifications on for more videos. And I'll see you guys in tomorrow's video. Peace out. Love you guys.